Hello, and welcome to Informatically Speaking, a Greater Delaware Valley ANIA podcast designed to promote knowledge sharing in the field of nursing informatics, locally, nationally, and globally within our unique industry. At GDV ANIA, we are committed to providing opportunities for professional development with the goal of advancing nursing informatics practice. I'm your host, Constance McLaughlin. In this episode, we are speaking with Tammy Kwiatkoski, a Senior Director of Informatics Operations and Implementation at HIMSS, where she leads various clinical informatics initiatives, fosters innovation, research, collaborations, and member engagement. Tammy also has a background in community and government affairs, and as well as project development. So welcome so much, Tammy. We're excited to have you.
Thank you.
So Tammy, when I approached you, I think it was quite a while ago, about participating in this podcast, you were a little bit hesitant to participate because it's produced by Greater Delaware Valley chapter of ANIA. And you said, the very first thing you said to me was, but I'm not a nurse. But we know that even though we primarily have nursing members, we also encourage non-clinical folks to participate. After all, it takes a diverse population to work in healthcare and in the informatics profession. And I know you would agree with that. There's lots of folks that are healthcare informaticists that are not clinical in background. So tell us about you. And tell us about your career path, because I find it interesting.
Well, thank you for that. And also for the confidence to come to speak with you today. And just share a little bit about my experience and a little bit about the journey that's led me to HIMSS, where I have now been for the past 12 years. I am a lifelong Chicagoan. Inclusive of all of my education, undergraduate and my MBA. So yes, and as I discussed with you, I have a non-clinical path that led me to HIMSS. And my career, I'd say, has indeed, taken some very interesting turns over the years. I actually began working in the political and government affairs sector. I served 4 years employed with the state of Illinois. One role was actually a very fascinating opportunity as a young professional in facilitating the governor's public engagement schedule and his involvement with groups or other agencies.
Wow.
So this included, preparations for his public appearances, such as briefing materials on where he was going and what he was speaking about, logistical planning on arrival time and space, working with security and advance teams, and identifying each of the individual roles of that he was playing at any of those appearances. And then the other role that I held with the state was within an agency, the Department of Natural Resources. I served as a community affairs manager in promoting the use of federal funds by the municipalities that surround the Chicago's lakefront. Again, my hometown. So that's where it all started. With that,
Interesting. Very interesting. Okay.
Yes, I think that's the little known fact about me. If you were to meet me, that's I think an interesting twist on how I began. But from there, I started. I also have about 12 years of experience working as a lobbyist here in Illinois, and that's where I started to assist our clients in navigating the governmental landscape and truly finding the way to advocate for their business, their association, or their organizational interests, and really trying to improve upon the services that were delivered to Illinois constituents through those organizations. And I think that's the part where I really learned to develop strong relationships and understand the value of strong relationships with elected officials, as well as business endeavors within the state of Illinois. And it really taught me the importance of effective communication and strategic planning and looking at the bigger picture. So working for that lobbyist is where I worked for an association as one of my clients that I represented. I realized then that it was my experience with advocacy, government affairs, community building, and it really aligned with the purpose of what an association tries to do. So with that experience and working for some tech companies and for some healthcare organizations, it allowed me to pursue an open opportunity with HIMSS, where, again, I've been for the last 12 years.
Wow. Yeah. And it's so important to take those life experiences and learn from them, because, and I think I've said this on other sessions with other guests for this podcast as well, is it's probably the most important thing about your job is building those relationships and networking and learning from others, right? So, and that's really gives you a leg up and helps you to move along in your professional career. And I think so many of us informaticists, I know I came from a healthcare organization. In my case, I had some IT background already, so it was kind of a natural fit for me to go that way. But a lot of people start out as clinicians at the bedside, or a CNA or EMT or what have you, and then kind of get tapped for an SME role, with some kind of a implementation, and kind of go that way. And that's the bulk of what I hear usually. But you still need to get out of your box and network with others. But that's why I just find it fascinating, your path to get to HIMSS and all of those things that you learned, and just the background, that diverse background that you have. And I'm sure you use it every day in your job, because you build upon what you live, right? So tell us about the work that you do at HIMSS. I'm assuming that you do work for the conferences and things like that, because that seems to be a lot of your background, organizing all those kinds of things. So what are the things that clinical informatics, what's the informatics operations piece of your job? How does that work?
So my role began here as the Senior Director of Clinical Informatics, and that is where I've had the privilege to work closely with the clinicians and our clinical communities and clinical healthcare professionals who are HIMSS members, from various work sites and roles that contribute their thought leadership and their knowledge and their need to network and or problem solve together. Recently, we've added the word operations to that title, where I am starting to work a little bit more across the entire society in weaving the clinical informatics communities and the informatics topic areas of interest throughout the society in a more comprehensive manner. So trying to be a little bit more strategic throughout the entire society about how we conduct our business and share our thought leadership. But truthfully, the main component of my job overall is really to oversee the various initiatives and collaborations that are related to our clinical informatics communities. So, that's everywhere that I would say what every individual does in their job is setting those strategic goals, managing the resources, and assuring the alignment with our society. So from HIMSS mission and vision to ensure that we're living those values. I've really enjoyed serving as the primary contact for our clinical communities. And, we provide the platform for these amazing thought leaders and subject matter experts to come and share their expertise, sometimes internally, sometimes externally, but really wanting to expand our ability to share and problem solve across the nation and globally. So instead of waiting for what's going to maybe be populated in a journal or a publication or a textbooks, that's certainly has its value, but it's great to share stories in real time and have conversation and dialogue throughout. So I think we are a good complement to that, to be able to expand our knowledge and share some real life stories. So you mentioned the HIMSS conference. It's always a very busy time for us as staff that go, and we certainly have our hands full. Again, pulling on my experience, we're there to manage a lot of the logistics to ensure that everything runs smoothly, to ensure that every attendee has a fantastic experience and has all of their questions answered while they're there on site. So it's really a fantastic opportunity for me to be there as a staff member, to help ensure that the conference goes as smoothly as possible. Aside from that, I just have, again, the primary responsibilities around the content development and the execution of anything nursing, physician, or enterprise imaging informatics. So that might include some of the pre-conference forums, the roundtables that we host, the networking receptions, the breakfasts. We also hold an innovation nurse pitch competition and innovation luncheon. We certainly have our general ed sessions that sometimes we're either attending as moderators and facilitating to support the speakers who are there during the general education, and working with a lot of our partners and our partner organizations to ensure that they also have an opportunity to speak about the work that they're doing and the collaborations that we have on various stages throughout the conference. But one of the happiest parts of my days there at the conference is to be able to execute the clinical Changemaker Awards and to do that recognition up on the stage and ensure that those thought leaders and amazing members are recognized. So that's always, the best part of my conference experience. So I look forward to that every year.
That is so nice. And, you going to these conferences, I realize that, times are tight and organizations are, kind of buckling down on education and things like that.
Mm-hmm.
But these are the kinds of things that are so important. And I know that you all have opportunities for calls, local calls and things like that. So it's not only the big conferences to go to for networking, but there's all kinds of local calls. There's roundtables, there's other work groups, industry work groups where you are definitely involved in as well. And of course, that's where we met, you and I met at the Alliance for Nursing Informatics. Is it a forum or it's a work group, right?
Yes. So the Alliance for Nursing Informatics is a co-sponsored collaborative group that is co-sponsored by AMIA and HIMSS.
Right.
And yes, ANIA is one of our fantastic members of that group. So that's one connection there. And then you were there to also represent your organization at the table.
Right.
So this is an effort to have a collaboration of about 25 nursing informatics focused organizations, or have a component of their organization focused on nursing informatics, to sit around a table and information share and really drive the importance of nursing informatics throughout all of our member organizations. And again, problem solve. We really try to break down the barriers and not have our walls up, and try to see how we can advance nursing informatics just a little faster, better, and really just network and build some really strong relationships, which has been fantastic.
Yeah, and it always comes back to that, right? And I think a lot of the conversations that I have, and a lot of the conversations within this podcast as well, keep coming back to that, but also coming back to the fact that everyone makes a difference, and everybody's got unique perspective. And, it's not just those people over there that are making the decisions and leading the way in informatics. It's folks like myself who came from a healthcare organization, made a leap of faith into the vendor side, came back out on the other side, but being in that making that change, making a change in my job, just that one decision led me down a path where I was meeting people like you, meeting some of the industry leaders that are making these decisions and being able to forge those important relationships. So, and being able to really, I wouldn't be able to have this podcast if I didn't make that decision and make that change. So it's just the encouragement of everyone who is hopefully listening to this in their space and saying, you know, what is my next move? What do I do now? Maybe it is looking at HIMSS because there are job availability there. It's within ANIA, it's within AMIA, or even just knowing that these things are out there, that these work groups exist. Get yourself involved, get out there and start meeting people.
Yeah, I agree. I think time and time again, that is the consistent with any webinar that I've been on, any networking session I've attended. Questions are always, how do I get started? And really is just get started. If you're joining a webinar, the reason why those individuals that are on there and asking if you have questions is because they're there to answer your questions, and they want to. They want to develop the next group of thought leaders and to help you in your next steps of your career. So start by just asking a question. There's no need to be silent. That's why we're bringing these webinars, and that's why our chapters are having local events to try to make it accessible. So I really just think that there's no way out. You can really just, once you start getting in, it's really an evolution of your network and a group of peers and colleagues that, become your friends. And then all of a sudden you're co-publishing and you have no idea what just happened. So I've seen that happen. And it starts just as simply as somebody raising their hand and asking a question, and it can really kick off something really exciting. So if anyone's just getting started, I know it could be very nerve-wracking. I walked into this organization feeling a little nervous, having never stepped foot in a hospital except to be a patient, but recognized very clearly that was enough. So I think it's just get started. Just dip your toe in, ask the question, and I promise it could be an amazing experience.
I love that, Tammy. I love that because it's so simple, and it's exactly what needs to happen. Just open your mouth and talk to folks, ask a question, just extend your hand, say hi. However you need to do it, it's just as simple as that to get started. So again, I'll just say, you inspire me. People that I'm reaching out to be on this podcast, they're all an inspiration to me and hopefully to others that are listening to this. Take advantage of the resources that you have out there. Take advantage of the national work groups, the national organizations that are available to you. And Tammy, before we close, maybe you can talk a little bit about some of the HIMSS resources that are out there that our listeners could take advantage of.
So I will try, but in building upon such a large organization and resources that are kind of vast and deep, I think it really is just very based on your interest level. So I do encourage you to be a part of a professional organization that makes sense to you. Certainly I'm here to offer HIMSS, and ANIA has been a great partner with us also. So I just encourage you to be a part of a professional organization. I do think that it brings a value and sends a strong message of your interest and your commitment to the industry, and really stands out then amongst your peers and even potentially within your employers. I have had individuals tell me that their contributions to a white paper that they then shared with their employer was something that really highlighted their career and added value to them to where they were, promoted. Now, I can't promise that to everyone, but again, I think employers value employees who proactively seek those types of opportunities and also can potentially then bring fresh perspectives back to your organization and to your work. So it's my belief that I think that you should get involved in a professional organization that makes sense to you. And when you do, you will find the resources. So if you go to HIMSS.org and search nursing informatics, you'll certainly find something like our nursing informatics workforce survey that Ania was kind enough to partner with us to distribute. We do that workforce survey every 3 years, and it's a great resource to kind of show the trajectory of nursing informatics as it's built over the, I think our survey, I'm going to mistake this, maybe the last 14, 15 years that we've run it. And within there, certainly there's additional resources so you can search by topic area or by interest and find some of that education that's online and on demand, as well as some live events coming up if you look in our events list on HIMSS.org. But there is a lot out there. So I know sometimes it's hard to sort through it, but it's again, just get started and find your interests, and you'll find yourself going down paths to create a strong portfolio of resources for yourself.
Excellent, Tammy. And you're exactly right. That's the way it happened for me as well. Just getting involved in a white paper and just being part of the research itself really just speaks volumes, so that you're part of a community, that you're doing work outside of your job. Is always important to an employer as well. So, so I completely agree. This has been great, Tammy. Thank you so much for joining. I hope you can come back again.
Well, thank you for having me. It was a pleasure. I'm not as nervous as I was when we first talked. You've made it very comfortable and accommodating. So thank you for that. But it's been a pleasure. So if I can ever be of support, please just let me know.
Excellent. Thank you so much, Tammy. Thank you for joining us today. We hope you'll join us again for another session of Informatically Speaking.
This has been a production of the Greater Delaware Valley chapter of the American Nursing Informatics Association. For more information about the GDV-ANIA chapter, visit us at community.ania.org/Greater Delaware Valley/home.